The average salary of a migrant entering the UK with a visa dropped by nearly £10,000 in just 2 years to £32,946. And the driver is our addiction to foreign social care workers. This is despite the salary threshold for the new arrivals being raised to £38,750 last week, because social care workers are apparently exempt from this rule. Will this nation ever get a grip on immigration? I don't think it will. This is only a small portion, of course, of it, because we also know that an awful lot of people come into this country to work inside the NHS as well. We've got a few NHS stories to talk about. So who better to raise it all with than NHS GP, Dr. Dean Eggitt. Dr. Dean, a very good evening to you. Welcome back to the Independent Republic.
Thank you, Mike. Nice to be back. Nice to see you.
Good to see you. Yeah, I mean, social care is such a big sort of area that I don't know where to begin, really. But certainly bringing in people from abroad to work in it is not only sort of necessary, it's absolutely necessary, isn't it? Because without them, there literally wouldn't be anybody in this country willing to do those jobs.
You're absolutely right. Social care is the Cinderella topic in the NHS and healthcare in the UK. We don't talk about it anywhere near enough, but when we talk about solving the NHS problems, we need to also talk about solving social care problems.
Yeah.
Because half of the issue is that when people get sick and they're finished in hospital, there's nowhere to go. Many patients can't return home and they need decent care, and we just don't have enough people to care for patients.
Right. And is that because the social care business itself is very badly organised? Because it seems to me that, you know, there's an awful lot of people at the top of it making a great deal of money running, you know, social care housing, running, you know, retirement homes, running care homes. But right in the middle are the patients who are paying through the nose, sometimes having to lose their house at the end of their life to pay for it. And meanwhile, the people looking after them are paid pretty much a pittance.
There is an argument that a lot of money goes into the businesses that run social care, but doesn't go to the carers. We know very well that carers often work ridiculously long hours in doing jobs that many people wouldn't choose to do for an extremely low income that many people, quite frankly, just wouldn't get out of bed for. So it's hard to recruit to, it's hard to keep staff in, and yet it's ridiculously expensive. So the question has to be asked, where is that money going to? It's going on bricks and mortar, certainly. It's going on some infrastructure, but it's not going into paying carers for their wages and their hard effort. So where is it going? I'd love to know the answer to that question myself.
And who determines exactly how much it costs for an individual to be looked after? Because it doesn't vary that much between various different councils. I mean, local councils will always say they can't afford social care and they haven't got enough money. But who decides how much it actually costs to pay for an individual's care? Is it worked out on an annual basis? Is it worked out on a monthly basis? How's it worked out?
So there is a budget that healthcare, or should I say care, is given to pay for individuals, and that's usually balanced out depending upon a weekly rate, a monthly rate, a yearly rate.
Yeah.
And then some patients will have to pay for that themselves. Depending upon the home that you choose to go to, depends upon that bill. So I can't give you a straightforward answer here. But needless to say, if you don't have a great deal of cash to spend, the government is not going to give you a huge amount of money to spend on the most brilliant care home. So the more money you have got personally, the better care home you're going to get and the more expense you're going to have to spend on it, which might mean liquidating your assets, selling your house if you've got it to sell, so that you can get the best care possible. The standard level of care available in England isn't brilliant.
No, and that is the problem, isn't it? Because at the end of the day, I've always said, and many people have said, that there should be, and the Labour Party is starting to talk about doing a kind of, you know, a complete and utter rehash of the system. But I mean, that could take years, because everything in this country always takes years. It just seems to me that if you're a member of what used to be called the sandwich generation, where you've got your own kids, but you're also worried about where your parents are going to end up, you know, it's a very unfair system as well, it seems to me.
Yeah, it's a pretty terrible system at the moment, and most people, I suspect, fear getting old. Certainly I do, because I do wonder, first of all,
I can tell you,
if there's going to be enough money in the pot to pay for my care, or if I'm going to have enough money to pay for any decent level of care. And even if I have got money, are there going to be carers around to look after me? So there is this urgency in the here and now, first of all for staffing, but secondly for people to have some finances to pay for an upgrade to care, because the basic level of care that they get is, quite frankly, in many cases, is not quality that any of us would choose.
No, sure. And I mean, NHS Reform is now clearly on the agenda for the Labour Party as well. Wes Streeting today was saying that you're going to have to look at, amongst other things, handing over some NHS work to the private sector. Now, they already do that in quite a strong way, don't they? It's quite a lot of people are sent to private hospitals and sent to private clinics by the NHS, funded and paid for by the NHS, because the NHS doesn't have the bandwidth to cope with it. So the Labour Party is now clearly at least admitting for the first time that the NHS is not exactly the golden child.
Yeah, and that's a really interesting topic, but I think it's a bit of a distraction from the real problem here. So first of all, Wes Streeting has got himself in trouble, I think, by being in Labour and saying, let's use some private healthcare, because it's not a typical Labour statement, but it's not a new statement either. That's exactly what the Conservative government is doing at the moment. And if you look at NHS England, what they've decided to do this year, they've made it very clear and say, we're actually going to use more private capacity. We are actively choosing to spend NHS cash on paying for patients to be seen in private hospitals to get rid of some of the waiting lists. Now, some people think that's a brilliant idea. Some people think that's a terrible idea because more money should be spent in the NHS. But the reality is, again, we don't have the capacity here and now. There's not huge capacity in the private system either, but there's literally no capacity in the NHS. So patients have got to go somewhere somehow. And in some cases, patients are going abroad and being sent abroad for care because it's just, we don't have the capacity here in the UK.
Yeah, but how is it possible that the NHS has got the most employees that it's ever had, which are now over 2 million, which is 1/3 now of all public sector workers? It's getting more money than it's ever been given. How is it worse than it ever was?
That's a great question. I'd like to say it's because we're successful. I mean, it sounds really silly, doesn't it? That, you know, how can what you've just described be also described as successful? Well, it's successful because people are living longer. People are living into an age that we just didn't expect them to live to. And of course, that comes with more care needs that we just talked about, more medicines that we just talked about, more visits to the hospital, more operations. So naturally, if the NHS is successful in keeping people around for longer, you're going to have to spend more on them for longer periods of time to keep them fit and able members of the community, or pay for care when they're not fit and able. That means more workforce. That means more expenditure. You know, the NHS, when it was invented, it was designed to make everyone fit and healthy and go to work. And they thought we would end up disbanding the NHS because everyone would be fit and well. But actually, the opposite has happened. We've kept people alive for longer, but we haven't necessarily maintained fitness. People aren't necessarily staying in work for longer. We're just having to look after them for longer.
Yeah. Well, people are also much lazier than they used to be as well. We've got 6 million people, you said earlier, don't want to get out of bed to go work in a care home. They don't want to get out of bed for any job because they're getting paid so many benefits and they're more likely to get more money if they don't actually work. And the problem is, it's not the NHS that's been so successful. It's just, you know, modernity, isn't it? I mean, you know, everybody around the world is living longer. You can't credit the NHS for people living longer in Portugal, living longer in Germany, living longer in India. You know, it's got nothing to do with the NHS. It's got to do with modern society. And we don't any longer die of diseases which we've more or less eradicated. That's probably down to science, isn't it? You can't really lay claim to that from the NHS point of view. And there's an awful lot of problems because you can't get a GP's appointment in a lot of places. In South East London, where I looked today, there's a good 10% of people who are still waiting over a month to see a GP. There's 150,000 people who are lining up who can't get into an A&E. There's, you know, waiting lists that are going on for years and years and years. So, I mean, you've also got 50% of people in the NHS who work for the NHS who don't do medical jobs.
Yeah, it's fascinating. Actually, you talk about the welfare state as well. And actually, the NHS came out of the concept of describing the welfare state. This guy, Sir William Beveridge, came up with the concept of trying to get rid of a lot of the illness and poverty and stagnation of people back in the UK, back when the NHS was invented. And that's when the welfare state was also invented. And the welfare state was there to keep people in food, in shelter, in warmth, so they were fit and healthy and could go out and work was the key point. So when all of this was invented, it was about economic growth. It was about keeping people fit, healthy and working. And actually very much the opposite has happened. It has given people the opportunity to come back from work, to not necessarily engage in work and to be looked after. So the welfare state is a success in terms of looking after people, but it's not a success in terms of economic growth. Now, coming back to the NHS point that I made, you know, the success of the NHS.
But as a doctor, though, Dean, you must also see the bad sides of the welfare state, which is that if you encourage people to not work, if you encourage people to have a life of leisure, it's actually not good for them. It's not good for them physically, it's not good for them mentally, and so it creates even more problems for the NHS.
You're quite right. And that's where I think we do need to discuss reform of the NHS and the welfare state, because it's not working out the way we expected it to. And I've lost count of the number of times when I've had to have a chat to a patient and say, look, if I sign you off sick long term on, say, that you're housebound, your health is going to deteriorate.
Yeah.
You need to be active. You need to engage with people if your physical and mental health is going to improve. Now, that doesn't apply to everyone who needs time away from work, but there's certainly a cohort of people who do need encouragement to be active in life again. And we're not helping those people right now with our welfare state.
No, I get that. Dr. Dean Eggitt, good to talk to you. Thank you very much indeed. We'll see you again soon.